So my name's Andrew McIvor. I'm a professor of medicine at McMaster University. I work at the Firestone Institute for Respiratory Health in Hamilton, Ontario. So chronic cough is actually a cough that is present for 8 weeks or more. That in general we define that because acute cough lasts around maybe up to 3 weeks, mainly with viral upper respiratory tract infections, and some people have subacute cough that lasts between 3 and 8 weeks, but after 8 weeks is really a chronic cough. There's a number of issues that can cause chronic cough. Some of them, of course, are obvious, and some are more serious. Think of common things like asthma and COPD and chronic bronchitis. We think of allergies and sinus problems. We think of reflux and gastroesophageal reflux disease and heartburn as being causes. Sometimes it can actually be due to medications, and some common medications, particularly those used for blood pressure, can be a very common cause of cough that sometimes isn't related directly to the day or week you start the medication. Then, of course, we have post-viral cough syndromes where you've had a virus and it just really prolongs. And then sometimes they can be idiopathic, meaning that at the end of quite an extensive investigation, we don't really find an obvious cause. And then we have to delve a little bit further into some perhaps much more rare causes. So the real thing about chronic cough is what does it actually do to your lungs? Well, the good news is the coughing is not damaging your lungs. Cough can cause headaches. People can cough until they pass out. People can cough until they sometimes crack a rib, although that's very rare. But the good news is the lungs are usually not damaged by the cough or because of the cough. Chronic cough, you have to be a little bit of a detective to get to the actual cause. And most people, we do have effective treatments, but it depends. Some people it may be an inhaler, particularly an inhaler containing an inhaled corticosteroid for the nose or for the lungs. In some other people it could be a proton pump inhibitor to help with the reflux. In some other people it may be different types of strategies related to their underlying condition. The really good news about chronic cough is there is help available for you. And don't sit at home and suffer. Don't worry about the stigma of having a cough. If you're worried about it, particularly if it's persistent, as I mentioned, particularly for more than 8 weeks, and if you have any other systemic symptoms, meaning fevers or coughing up blood or loss of weight or whatever, it is very important to seek medical assistance and advice to make sure that we're not missing anything more sinister or serious. But most people that have a chronic cough, it's more of a nuisance. But seeing a physician or healthcare provider can help you navigate that and make sure you're on the appropriate treatment. We don't want you taking over-the-counter preparations for months or years needlessly.